cannot afford water and sanitation services? This question was examined in depth in a new report launched recently by UNICEF and the World Health Organization, titled The Measurement and Monitoring of Water Supply, Sanitation and Hygiene Affordability, a missing element of monitoring Sustainable Development Goal Targets 6.1 and 6.2. This subtitle draws attention to the fact that affordability is explicitly stated in the WASH targets and is one of the normative criteria of the human rights to drinking water and sanitation. However, we do not monitor it currently in any systematic form, and this gap in monitoring threatens the achievement of the ambitious WASH targets set under the Sustainable Development Agenda. The report proposes that affordability can be assessed in 5 different ways, by looking at, first, how people behave with respect to WASH expenditure and service levels. For example, do we see households not demanding the available services because prices are too high for them? Second, what people say about their preferences on WASH expenditure and service levels, either through surveys looking at willingness to pay or through complaints mechanisms and street demonstrations. Third, we can examine how WASH expenditures compare to an agreed benchmark on WASH spending by looking at what they spend on WASH as a percentage of overall household expenditure. This is the most common method, and I will return to it. Fourth, can we simply use a household's poverty status to determine whether they are likely to afford a WASH service with a particular price? Fifth, we can document what measures are already in place to ensure that poor and vulnerable have economic access to WASH services, such as a policy or a resource allocation, and we can identify how much public funds or grants are reaching the most needy. Some of these approaches are difficult to implement on a national scale due to lack of data or lack of clarity what policy measures are needed. As mentioned earlier, most previous attempts to assess affordability have looked at what monthly payments households make on water and wastewater services and compare it with their overall expenditures. This calculation generates a ratio. Governments and service providers have used a range of ratios from 2% to 6% of total expenditure, above which would be considered unaffordable. This is a practical approach, but it only works well when the stated payments include the majority of WASH expenditures and they provide access to at least the minimum national standard for WASH. However, in many contexts, these conditions do not hold, as the monthly water bill may not account for capital expenditures and may omit some recurrent cost items, such as maintaining a toilet, soap for hand washing, or treatment of water by the household. Also, these estimates exclude the cost of time to access water and sanitation outside the home, which, although it's not a financial cost, it uses valuable time and energy of household members, especially women and girls. Therefore, our recommendation to countries is to look not only at what households are currently paying for WASH, but also to estimate what households experiencing a service gap would have to pay to access the minimum standard. How does this required cost compare to household incomes, and what is feasible for them to pay without threatening other essential expenditures such as food, housing, health, education, and so on? In so doing, it's critical to disaggregate the data by different categories of household, such as poor and non-poor, rural and urban, and by other vulnerable groups. So while the above considerations need to be kept in mind, it is very feasible to implement affordability assessments in countries, as was demonstrated by 6 country case studies we conducted. Through the Sanitation and Water for All partnership, we can mobilize key stakeholders across multiple constituencies to achieve affordable services, including governments, the private sector, academia, donors, financiers, and international organizations. We will achieve the 2030 goals only if we work in a coordinated fashion and harness fully the capacities of each party has to bring to the table. As well as a mobilizing force to redouble our efforts and work in partnership, SWA is a learning organization, and we can only reach our goals if we manage what we know and take bold steps to innovating and doing things differently to achieve affordable services for all by 2030.